Okay, good evening, everyone. Welcome to Crystal University. Uh, this is going to be our third lecture, and we shall be looking at scheduling principles and techniques in healthcare. First, our learning objectives. By the end of this lecture, you should be able to explain the importance and challenges of scheduling in healthcare settings. Compare and contrast different types of scheduling methods. Apply basic principles and tools of operations research and analytics to design and evaluate scheduling policies and procedures. Identify and analyze trade-offs and ethical issues involved in scheduling decisions, such as patient satisfaction, staff utilization, quality of care, and equity. Discuss current trends and innovations in healthcare scheduling. Scheduling principles and techniques, we look at, we said it's effective scheduling is critical in healthcare to optimize resources utilization, reduce waiting time, and enhance service delivery. First of all, what is scheduling? It is just like how you organize the schedule, to meet the particular patients in the healthcare setting. We have ever seen that appointments sometimes are necessary, and this one goes with time. It goes with resources. Needs the health clinicians to be there, and then also the patient to be there according to the agreed times. So if this is properly handled, and then of course we shall optimize the resources utilization. We are looking at both the human aspect and also the material resources, reduce waiting time, and also enhance services delivery. Importance of scheduling, we look at these three summarized options here. One is optimizing resources, two is accommodating patient needs, and also thirdly, ensuring efficient operation of activities. Principles of efficient scheduling, we have prioritization of urgent cases. I guess this is what those of you who have been in the clinical practice normally does, especially with our triage systems. Okay, patients come in the morning and then they start queuing up, and then all of a sudden you realize that you can't use first come first serve all along from the start up to the end. You find some patients already arrive with a critical scenario. So here you will have to set up your triage, and then you need to take those with emergency presentation right away for to be attended to, other than waiting in the queue in the first come first serve basis. Otherwise, it will be late already. It will be late for some of them. Okay, buffer time for unexpected events. So this is trying to tell us that whatsoever our schedule in the facility, like already we have a plan of what we intend to do at 8 a.m., 9 a.m. up to the end of the day, but make sure that you will always have a buffer time. In case of unexpected emergencies, you know that your normal schedule will always be disrupted. Otherwise, if we don't have it in the plan, indeed, we might be taken by surprise. Okay. Synchronize patient, staff, and resource schedules. So to synchronize means to be able to make these activities run at the same time in a coordinated manner. Okay. We have adequate number of staff for today, and then we have adequate. We have more patients today. We should have adequate number of staff. For example, I can give you the example of our antenatal care visits with my personal experience in the maternity department. We always have scheduled dates for ANC visits. This is simply because of staffing issues. ANC, especially first visit, comes along with a lot of requirements where we need to test this woman for quite a range of tests that the laboratory has to do. But also, not only that, a lot of history taking, filling the form, but you find only sometimes in the primary health care center there's only one midwife for the day duty, sometimes only two. So you see, all this makes it difficult if we don't have a scheduling process where sometimes you say, okay, come our major ANC is on Tuesday, but this does not mean that we are not attending pregnant women that come at any time. But for the routine things, you find there are specific days in all these primary healthcare centers simply because of synchronizing, patient and staff to be able to meet the resources we have. Continuous monitoring and adjustment. This is very important. Okay, this is very important because the more we continuously monitor, the more we are able to adjust. If we see that the ANC visits, we are even receiving more and more pregnant mothers to the point that we finish them late or the waiting time is too long. These mothers come in the morning and we find maybe somebody leaves the facility at 12 noon or even after lunch. Is already telling us that they are taking too much time at the facility and maybe our staffing is not enough. But if we monitor this continuously, maybe we can look at alternatives, resource-wise or maybe time-wise. We can readjust our schedules so that at least we can have changes. So continuous monitoring and adjustment is very, very important. Scheduling methods in healthcare, we have one is appointment systems. Two is our queuing models. Okay, we look at the queue and then we apply our model to analyze it further and find solutions to improve the queuing system. Simulation techniques, we already talked about it, and in chapter 1, again, it is something we are applying here as well. Appointment systems, appointment-based scheduling is a common method in healthcare where patients are assigned specific time slots or appointment for their medical consultation, procedures, or tests. So basically, we do this appointment. You might be familiar that this is a bit more practical, especially in the context of South Sudan. I mean, in US specifically with the private facilities or the consultancy units. In the hospital as well, we still do this for specific cases. Okay, we have also our special clinics, and then we have like specific schedule times for specific patients. Okay, how it works. Patients contact the healthcare facility to request an appointment. This point might be going well, especially with the system in the West. But here, still in our setting, a patient first of all comes to the facility, maybe for the first meeting, and then the clinician will decide maybe a certain appointment after the first meeting. But why I was trying to say the first this point number one here is more practical in the West system because basically there a person can just make appointment even online without even seeing the physician first of all. So just online you already have the contact of your healthcare provider and then you just make an appointment and it's done. Okay, no physical movement in the first place. The facility schedules the appointment based on the patient's availability, the physician availability, and the nature of the medical service required. Exactly. Okay. So if this person needs to be seen, and then our facility will look at, okay, what is this case? Is it an obstetric case or is it, who is this person meeting? Who is the right person to meet this particular person? So as a facility, we need to look at, okay, at what time will that one be and who is the physician that will be seeing this person? Okay, or what, depending on the nature of the medical service required by this particular person, and then all this the facility can be able to arrange, and then time is saved. Patients receive confirmation of the appointment, date and time. So exactly, if after the facility has arranged all this, and then we are giving feedback. Okay, yes, you can come. Your appointment is already booked as per the time that you have selected. Here, the person normally specifies the time he will wish to be seen by the physician will be coming to the hospital. And then if we have a feedback, we give it back accordingly. If there is a timely adjustment we need to make, and then we have to give feedback to the person, and then the person can also be able to reply to see that, okay, maybe the time there is convenient for the both of us. Okay, we look at the benefits of appointment systems. Uh, One is it ensures efficient resource allocation. Like in the previous slide already, we talked. It helps healthcare providers allocate their resources. Okay, here we look at the physicians, also the equipment, and even the facilities effectively, therefore reducing idle time and maximizing utilization. Okay, reducing idle time because already all the minutes are already they spent. If I know that in my consultation room 30 minutes is enough for one person, I can already make a schedule that, okay, the list of maybe 18 persons or 20 persons that I will be seeing during my duty, every 30 minutes, I'm seeing this particular person. Okay, so there will be no idle time. Everything will be to the maximum. Reduce waiting times. Okay, patients benefit from shorter waiting times and receive care at a designated time because of better appointment schedules. Improve patient satisfaction. Appointment-based scheduling enhances the patient experience by providing predictability and convenience. So already, first of all, making timely appointments already is the first step to a patient satisfaction, by the way. We should be knowing that our patients sometimes get quite distracted when they come, and then, you know, the line is too long and there's one clinician there attending to patient. This is that is already first step in the dissatisfaction. Okay. Appointment techniques. We look at open access settling. With open access settling, we say this one allows the patient to request the same day or the next day appointments and reducing waiting times and improving access to care. So this open access scheduling is the one where the person makes the request and the person can say, I need to be seen by today. Okay, it is open. It is based on the patient's will. Or the person can say, I'm coming tomorrow. Okay, and then he'll have to get feedback from the facility. The benefit of this is it minimizes backlog. Backlog is like accumulation of patients, you know, in the queue. You are already attending to them, but because they came very many, and then they accumulate. Okay, and then improves the patient flow and also reduces no source. Okay. No, so here is this word should be familiar with you for those who have ever traveled. There is a ticket that we say no so ticket, which we always try to avoid. This is where you have booked your plane and the plane is waiting for you, and for certain reasons you do not show up. Your ticket will be considered a no so, and it is a very expensive ticket you'll have to pay for again because you you have spoiled the schedule of this flight. They are waiting for you and you do not show up. So no so here is like you made an appointment has been made between the facility and the person, and then a physician is there waiting to see this particular person. But at the end of the day, you are waiting, but the person has not shown up. Again, it frustrates us at the receiving end as the health, I mean, the services providers. It frustrates us. So you see how it happens both ways. Okay, to the person and also to us, the service providers. Number two is web settling. Web scheduling groups patients appointment into specific time slots. So here we are not like taking one person at a time, but we can group patients into time slots. Okay, accommodating a moderate number of patients and then at regular intervals. Advantage: there is a smooth patient flow, reduced waiting times, and also better staff utilization. The web scheduling normally will also help us to be able to program according to the number of staff we have, and then also we can see how many patients, okay, can be grouped to come at one point, but at the end of the day, they are not going to be seen as a group, but they go one after the other to the consultation rooms. Appointment technique. Number 3 is modified web scheduling. So the modified web scheduling combines a web scheduling with flexibility. So here is just like number 2, but we also add in some flexibility, okay? Allowing for variations in appointment durations or or accommodating more complex cases. Flexibility adjusts for varying appointment needs while maintaining efficient scheduling. We have advanced access scheduling. Advanced access scheduling focuses on providing patients with same day or next day appointments as the standard practice. Okay, so in advanced access scheduling, uh, this one is focused on providing patients with the same day or the next day appointment as a standard practice, just like what we previously discussed in the first one. The benefits of this is it enhances patient satisfaction, also reduce backlog, and also improves access to care. Okay, we have our appointment softwares. You know, softwares are coming up these days in many areas, but also the medical field is one of the important consumer of these softwares. So they have been designed to be able to maximize achievements, how best we can be able to manage our health systems. So this one utilizes specialized appointment scheduling software or electronic health record EHR systems that offers scheduling modules. These systems allow for efficient appointment booking, tracking, and even management. Features may include automated appointment reminders, okay, real-time availability checks, and integration with patient records. So these are just softwares that are already programmed. Okay, so it could already give us it acts as a reminder so that we don't forget already those appointments there. Just like the way the calendar works. Okay, real time availability checks. It can also do that and integrating with patients' records for better. Let's look at centralized versus decentralized scheduling. We say centralized and decentralized scheduling approaches are based on the size and complexity of the entity. Centralized scheduling involves a single scheduling department or a team handling all the appointments, ensuring consistent scheduling practices. Meanwhile, the decentralized scheduling allows individual departments or clinics to manage their own appointments, providing more autonomy but requiring also coordination. So, for example, let's take the hospital as a whole, perhaps a higher level hospital, maybe like Juba Teaching Hospital with various number of departments, okay, obstetrics, gynecology, surgery, special units, okay, ophthalmology, uh, ENT, psychiatry, all those different units in the hospital. So in decentralized scheduling, this where these schedules are handled by the specific departments. Okay, the maternity ward will always have its own schedule of the cases they attend to. The medical ward the same. So what we are trying to talk here is that with the decentralized system, I guess this one should be the most practical one that we have. Maybe with our Juba Teaching Hospital, for example, and maybe most of even the facilities we have. For centralized, this is where in the whole hospital, like Juba Teaching Hospital itself, there is a one unit that handles all the appointments. Okay, so all these appointments will be centralized already. One unit knows that at this time this patient is meeting so and so in ops and gyno. At this time, a patient number this is meeting somebody in the psychiatry unit. That is the centralized. Decentralized is where each department handles its own appointment and I think this is more practical of our systems around. Queuing theory. This queuing theory is a mathematical approach used to study and manage patient flow and waiting times in the healthcare setting. How does it work? The models analyze the flow of patients through various stages of care, such as from the registration, and then the triage, and then the examination. Okay, here we're talking of the physical examination or even including the lab examinations, and then up to the discharge. They consider factors like arrival rates, services time, number of available service providers. Queuing models also help to determine optimal staffing levels, identify bottlenecks, and estimate waiting times. This is perfectly practical. Okay, it describes the sequence of events from entry up to the exit, looking at the time and also the services and even the number of service providers. Because already at the end, this will give us a measure of how fast things are going, or if maybe we don't have adequate staff to make things move faster. Benefits of the queuing theory are the queuing models enable healthcare facilities to allocate staff and resources according to actual demand, therefore reducing overstaffing or understaffing. Very important. By optimizing patient flow, queuing models can minimize waiting times and enhance the patient experience. Effective queue management can lead to cost savings by avoiding unnecessary staffing or resource expenditures. So, at the end, it benefits both ways. Okay, it helps us know, are we having too many staff at one department, such that maybe some of them are already redundant? The problem of also overstaffing is that when someone becomes redundant, is also a problem to the whole system actually. Or we have also understaffing that is now causing a lot of delays. So these modules will be able to help us maximize benefits by looking at efficiency. Simulation techniques. Simulation involves creating a computer-based model of healthcare process and scheduling to test different scenarios and improve scheduling strategies. It works. How it works? Healthcare providers input data into the model, including patient arrival patterns, services time, and resource constraints. And then the simulation machine runs multiple scenarios, allowing providers to access the impact of the different scheduling strategies, staff levels, or facility layouts. Providers can then make informed decisions based on the simulation results to optimize scheduling and resource allocation. So what happened with the simulation technique? We already have the tool that will run the data. It's like a computerized uh, activity that we do. So you already have your your uh, your input. Okay, you have input that already you enter into the system based on the number of staff you have and maybe even the time schedules. The time spent, records for time spent while attending patients, including patient arrival patterns, service times, all these kind of things. So you have these details, you enter in the machine, and then it works, okay, trying to synchronize all this, and then it gives you the results. And the results will interpret just like the graphs that we do, like the models that help us analyze uh, uh, to see the outcome and uh, possibly gives us a better uh, display of what the results means from the input. The result will be pointing us to certain things that we can be able to improve on. Benefits of simulation techniques. Scenario testing. Simulation allows healthcare facilities to test various scheduling scenarios without real world consequences. What does this point says? So here already we have like a record of the activities we are doing, and this becomes the input that we enter into this machine, and then later on it gives us an output that can help us decide on the next planning. Activities that we can take. Uh, So it allows us to do this without real world consequences. So it is not like, okay, I need to see if I really have many stuff and then, okay, let me reduce other stuff and see what will have happened. That is not how it works, okay? And that's why we are saying without real world consequences. It is the machine you enter already what you have and it helps you to plan. Otherwise, you don't need to do a trial and error by saying, okay, maybe in this department, let me send somebody home and see how the work will go. This is what this point says. Continuous improvement, it helps providers identify bottlenecks, inefficiencies, and areas of improvement in scheduling a patient's flow. Okay, and also enhance decision making. A simulation provides data-driven insights for informed decision making. Already, what we shall obtain here will help us make an evidence-based decision because already we gave an input and then we are given an output, and then it helps us make better decisions. Staff scheduling is essential to ensure the right health care professionals are valuable when needed. The techniques we use is the shift. Okay, we can have shift. All of you are aware about shift. We can have morning shift, night shift. Some better equipped facilities even can use the 24-hour shift where you divide into 3 shifts. Okay, 8 hourly. After 8 hours, some people come in, hand over another one. Okay, we have what we call rotating schedules. This one is a bit different from the shifts, but at least it's like a kind of rotation. Okay, this one works on Monday, another one works on another day, and then it becomes a cycle. Self-settling systems. Okay, so self-settling. This is like a kind of voluntary settling that still can happen. Okay, somebody can just come in and takes over a kind of a duty. All this happen actually. All this happen in all our normal settings where there's too much demand. You know, somebody can just come in and does that. And then we have the demand-driven scheduling. We'll give here the example of our malaria fig. In South Sudan, we know very well, even many NGOs already have a kind of this demand-driven scheduling where they may decide to hire new staff during the malaria peak, but this could be a short contract, only 3 months or 4 months, and then after that, this staff is laid off because already they know that the purpose of this was a demand-driven, and then maybe again next year the same thing. Shift scheduling involves assigning employees specific work hours and days, ensuring continuous coverage. The advantage is that there will be predictable staffing, clear roles definition for each one, and then well-defined working hours. Okay. Rotating schedules, this cycle employees through different shifts or work patterns over a period. Already I mentioned this. The benefit is there is equitable distribution of shifts, reduce employee burnout, and coverage for varied shifts. Self-settling systems. Self-settling empowers employees to choose their work schedules within predefined rules and requirements. Okay, somebody just chooses when he feels he's able to work voluntarily, and then the system allows for that. The advantage is there is improved employee satisfaction, better work-life balance, and reduced settling conflicts. Well, we know that all of these settling systems have their own disadvantages. Okay, but here we are trying to see the advantage of the self-settling. And one example I can give here is that, well, even when I was a student, or after even finishing, we could see that in the hospital, many people would prefer to be off during the weekends because, yeah, many activities happen in the weekends, but our schedule doesn't allow that. So people like in a self-settling kind of thing is where uh, the system allows, and you can choose that I'm working Monday to Friday. I don't want to work on over weekend, for example, and that is self-settling. Okay, or you will say, I'm only going to work on Friday. I mean on Saturday and Sunday because Monday to Friday maybe I have other things to do. All those are examples of self-settling. Demand-driven settling are just step labels based on patient demand and workload. The techniques can be a real-time patient volume monitoring, flexible staffing based on demand patterns, and also predictive analytics for future demands. Implementing staff settling techniques. We have the strategies and successful implementation involve assessing workforce needs and skill sets, training staff and managers on settling methods, and utilizing settling software and tools for efficiency. Proper settling of equipment usage optimizes resource allocation and also reduces the downtime. The techniques here is preventive maintenance schedules, real-time equipment tracking, and equipment reservation systems. Facility settling. We have efficient use of healthcare facilities crucial to accommodate patient needs and reduce overcrowding. Here we can use the block settling, we can use streamlined facility management systems, and we can use integration with patient and staff schedules. With block system, we mean this one is where a specific time blocks are allocated for different purposes, such as surgeries, procedures, or specific departments. The example we can have here is like for example, if we have those non-emergency procedures in the surgical department, okay, we can have a block settling where we say our theater will be operational maybe on Wednesday, okay, and then those cold cases we can just say every Wednesday is for this particular kind of case, or every Friday is for this specific kind of cases. So that is an example of block scheduling. Advantages is optimized resource allocation, reduce conflicts, and also streamline facility usage. A streamlined facility management system integrates technology and processes to manage healthcare spaces and resources efficiently. The components are real-time facility monitoring, reservation systems, and also resource allocation optimization. Integration centers ensures facility schedules align with patient appointment and staff availability. The benefits, there is improved patient flow, reduce waiting times, and also enhance resource utilization. Okay, implementing facility scheduling. Successful implementation involves assessing facility needs and usage patterns, collaborating with staff and the departments, and then deploying facility management software for efficiency. Okay, reducing patient wait times. Effective scheduling reduces patient wait time, enhancing their experience. The techniques, we can use the lean scheduling that we already talked about in a previous lecture. We can use just-in-time scheduling. We can use the streamlined workflows, and also we can use the predictive scheduling algorithms, okay, to help us forecast what might happen in the next days and how we can adjust accordingly. Reducing patient wait times. Lean scheduling principles are derived from lean management methodologies to eliminate waste and optimize processes. Just-in-time scheduling ensures that resources, including staff and equipment, are scheduled precisely when needed, reducing idle time and waiting periods. The benefits is maximizing resource utilization and minimizing delays and also reducing cost. Principles of reducing patient waiting times. Key principle is value stream mapping, reduction of non-value added steps, and continuous improvements. Value stream mapping. We say the value stream mapping is a visual representation of the entire process of delivering healthcare from patient admission to research. It identifies the value added and the non-value added steps, helping healthcare organizations understand and optimize their processes. So here we shall look at what is really adding value and what is not adding value, and then we can look at balancing them. Okay, how we can minimize non-value added steps to maximize benefits. For example, in a hospital, the value stream mapping process may reveal that the time spent by nurses searching for medical supplies is a non-value added step. And by the way, this is what most of our hospitals do. Okay, in South Sudan, we don't have not many of our facilities. Maybe some private facilities have already a digitalized system where a patient comes and then maybe data are entered directly to the computer. But here, for example, a person comes and then we are writing everything down with the pen. At the end of the day, we also need this computer, this information to go to the computer so we can be able to visualize these records. I don't even think that quite a number of all of them are really well being entered into the computer. So later on, it becomes quite difficult for us to visualize our data, because already a lot of time will be spent trying to enter this into the computer, and if we are to make analysis later on, already a lot of time is spent. So by streamlining the supply chain and ensuring that necessary supplies are readily available, this wasted time can be reduced and nurses can spend more time on patient care. I still want to come back to this point. Especially, I sympathize with midwives because I've been working with midwives for quite a long time. The paperwork is too much. Okay, right from, if this is a labor case, right from the admission of this woman on labor, the monitoring processes, progress of labor, the pathograph searching, after delivery, details of the baby, quite a number of everything, including the vaccination. But then all these things are done. Maybe this midwife is alone on duty, maybe with only a TBA. We know that sometimes some of our TBAs are still in the in some of the facilities working as midwives. They might not have the capacity even to document. So at the end of all this process, this same midwife is supposed to do again the clinical. She's doing this concurrently with the clinical care for the patient. So we could save we could save more time here, so that the midwife has even more time with the patient. Then also being able to minimize this kind of delays. We know that the data is an important part of the work it does. So all these kind of things, we know how it challenges us in the facilities. It's not just the midwives, but the nurses, the doctors, the clinicians, the clinical officers. I just use this example because I've seen that quite a number of reporting tools in the midwifery room. Reduction of non-value added steps. This principle focuses on eliminating or minimizing activities that do not directly contribute to patient care or add value to the healthcare processes. Reducing non-value added steps can lead to increased efficiency and cost savings. For example, in a primary care clinic, the administrative staff might identify that they spend a significant amount of time manually entering patient information from paper forms into the electronic health record system. By implementing electronic forms or automated data entry solutions, they can eliminate this non-value added step, reduce errors, and free up time for more meaningful tasks. More or less related to the example I've just described. Our principles of reducing patient wait time, we said continuous improvement. Continuous improvement, often associated with the lean methodology, encourages healthcare organizations to regularly to assess their processes, gather feedback, and make incremental changes to enhance quality and efficiency. For example, a surgical department in a hospital may implement a continuous improvement process by regularly reviewing surgical procedures and outcomes. Okay, through feedback from surgical teams, also from patient data, they identify areas for improvement, such as reducing surgical site infections. Implementing updated protocols and best practices leads to ongoing improvement in patient outcomes. So, for example, if all of a sudden we realize that a number of uh, 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 surgery cases, patients that underwent surgery are coming back to the facility with infected wounds. If this has been a recent happening in the facility, then we need to find out what might have gone wrong in between. You know, it could be something to do with our sterile procedures, perhaps. Okay, and then we look at all these kind of things through feedback from surgical teams, patient data, identify areas of improvement, something like that. Streamlining workflows involves optimizing the sequence of tasks and processes to minimize patient waiting time. The techniques are processes mapping and re-engineering, workflow automation, and clear roles and responsibilities for each and every staff. Predictive scheduling algorithms use historical data and real-time information to forecast demand and adjust schedules proactively. We already mentioned in the first lecture that our historical data is what we already collect from patients, for example, in our registers for last year, for this year, or maybe for last month. Those are already historical data. And then we use these ones, okay, to be able to forecast what we might be expecting in the coming months basing on data information from previous trends. From previous records to give us the upcoming trends. Applications, predicting patient arrival patterns, anticipating resource needs, and also minimizing bottlenecks. Okay, minimizing variability, reducing variability in scheduling leads to a predictable and consistent service delivery. So if we can minimize a random variation, then that means we are a bit sure of what we are trying to predict. Okay, this is what the point is trying to tell us. The techniques, we use standardized scheduling templates. We can use contingent planning for disruptions. Remember, we mentioned previously already about having a contingency budget in case things go wrong. Okay, maybe we are just working in a facility and then all of a sudden there's an outbreak. There's a cholera outbreak in the facility. We need to have a contingency plan to be able to contain this outbreak. We need so many beds. We need more workers. So this is a budget planning in advance. Start training on scheduling best practices. We know that well once the staff are well trained, that means anytime they are capable of providing the best. Data-driven scheduling, leveraging data and analytics can optimize scheduling and resource allocation. The applications they are used in predictive analysis for patient demand, real-time monitoring of staff availability, or equipment maintenance based on usage patterns. Okay. Implementing settling techniques, training staff on the Susan settling method. Okay, so that at least every staff knows how to use the method. Aligning settling with patient demand patterns, and then continuously monitoring and adjusting schedules for optimization. Okay, once again, we have come to the end of this lecture. Thank you for being with me, and bye bye. See you again in the next lecture.